Hello, my name's Aaron Cummins. I'm the Chief Executive at the University Hospitals of Morecambe Bay NHS Trust. I'm just going to spend a couple of minutes today giving you a bit of an update of the work that we've been doing as a group of hospitals, and also just to remind ourselves of some of the work that we continue to do as we deal with and prepare for the next phase of COVID-19 and the pandemic that we've been dealing with recently. I'm going to start off with a huge thank you, as I tend to do when I do pieces like this. And I won't ever get tired of saying that, actually, because I know in the headlines now we can start to see that it's really obvious that we've dealt with together the worst of the pandemic at this phase and we're coming out through the other side. So the numbers of patients who have the disease with us are much lower than we've seen. The numbers of deaths that we've seen from the disease are reducing, and we're starting to see some of our normal activity come back online. But that doesn't change at all the work that we've been doing together as a group of colleagues with our communities and our neighbourhoods to protect each other and deal with this disease as best we can. And it feels particularly poignant this week. It's the NHS's 72nd birthday. I've never been more proud to work in the NHS over this period, and I've never been more proud of the teams that we've got working with us at the moment and with our communities in the way that we've dealt with this particular set of circumstances. One of the things that I was just going to mention today is, whilst we work through the remainder of this year, as a hospital and as a care provider, we generally talk about what our objectives are for this year and what our priorities are. And actually, although COVID is dominating a lot of our activity, it's not everything that we do. So myself, the leadership team and the board have come up with 4 key priorities for us this year. To deal with COVID as best we can and to keep each other as safe as we can through this period. To make quality and safety of our services a core priority. To look after each other, to make sure that the health and well-being of our colleagues is a top priority. And to then focus on what I would call post-COVID recovery or transformation. And I think the last time I gave a message like this, we were talking about bringing services back that are non-COVID related, or taking advantage of some of the improvements that we've seen through this period that we want to keep. And that's our focus now over the remainder of this year, over the next 6 to 9 months. And what you'll see is more messages from the hospital about, what treatments we're starting to offer again, how you access services, what we'll be doing as an organisation to keep people safe as they come back onto our sites. So things like PPE equipment, like masks being worn, or some reminders with some visuals around our sites about social distancing. So whilst you might see in the press and in the media, lots of our lockdown restrictions are now being lifted. I know pubs and restaurants and hairdressers, not applicable to me necessarily, but I know lots of colleagues were looking forward to the hairdressers being opened. The disease is still with us. So our message is still the same. Work from home where we're able. Always socially distance up to 2 metres. Let's wear our PPE as we're moving in communal areas, and let's wash our hands. So a thank you from me, a reminder of some of the work that we're doing that's non-COVID and what you might see from us as a hospital over the next 6 to 9 months. And for us to make sure that we're all taking our responsibility seriously through this next phase to do all we can to keep this disease at bay. Thank you.